for something else. At the local level in New York City in 2010, they set out to reduce chronic absenteeism in school. And they set up a task force with a dozen different city agencies and 20 community-based nonprofits to develop a new intervention and monitoring approach. And they started with 100 schools, and it worked. And students spent an additional 80,000 hours in school that the schools that were actually participating in this. So then that program was expanded. At the Center for Disease and Prevention, and there's a program called PulseNet. And in 2013, when they had the sequester, Congress came back and passed a provision that allowed the PulseNet program, which was out looking for tainted food in communities, to continue operating. They were able to show that for $10 million a year, they were able to prevent $219 million in hospitalization and other costs. So these are programs that were able to show through evidence that they made a difference. So let's go to the next slide. Sorry, you have to double your everything. What I want to do is figure out, is this evolution of evidence-based government just a fad, or is this something else? The whole TQM movement and Lean Six Sigma and balanced scorecard and people in government say, well, here's the passing fad, the passing flavor of the month. But what I think is interesting about what I'm seeing on this evidence-based stuff is it's a little bit more sustained and has a little bit higher attention from a wider range of stakeholders. The thing that I found fascinating is that this has support in Congress, it's bipartisan, it's something that this administration has been promoting, and if you look back in the previous administration, there were threads of that there as well. And so that's what I want to talk about with you this evening. Now there's a set of organizing principles that they have. Focus on outcomes and lives changed rather than compliance. Another is use data and evidence to continuously improve quality. I think that sounds familiar. Another is invest and scale innovations that work. And direct public dollars away from programs that don't work. And invest in communities and in programs that are willing to use data to make a difference. So those kind of principles are something that's driving this movement, and that's why it's so engaging to either sides of the political spectrum, because they both think that this will show that they're right. So like the quality movement, it uses data. They may use a little different language than it is. They may use different techniques. They may have a different emphasis, but I think the ultimate outcome and emphasis is the same. So you have this confluence of different trends, and that's why this is happening now. First, there's more data. With open data that this administration's promoted, there's a lot of administrative data that just wasn't available to be used. What's interesting is the data that are being made available isn't being used so much by the private sector or the nonprofits or the advocacy groups. It's being used by other agencies because they're finding that data from NOAA is helpful in interior, or data that's from air traffic control is helpful in homeland security. So there's a lot of things that the agencies themselves are using this data. The second is that there's more analytics. There's a lot more tools that are available. There's GIS tools, there's just all sorts of statistical tools, there's big data, there's optimization tools, there's just all sorts of things that are available. The other thing is that there's more interest, and it's by a wider range of people. It's not just the quality people, it's not just the statistical shop, it's just not the program evaluation shop. It's kind of like everybody's into this, and it's because the tools are a lot easier to use. And so you have not only a range of professional disciplines using it, you also have it being done at the federal, the state, the local, and the nonprofit areas. And the political leaders are seeing it as an advantage in an era of tight budgets. Next, there's also more incentives to use it. The Office of Management and Budget is encouraging agencies to have tiered evidence so that if a program is proposed, you give a little bit of money to it. If they can demonstrate it's working, you give a little bit more. And if it really seems to be working, then how do you scale it? So they're beginning to target funds. They're also saying that for formula grants, et cetera, they're reserving a portion of it, and you give higher points to organizations that show that they're using data to make a difference. And then finally, there's more leadership from the federal government, from OMB, within states and localities, and very interesting, there's a huge push within foundations around this. Currently, a lot of this is in the social and the health areas, not so much in national defense or infrastructure, or transportation. My guess is this stuff will sort of migrate from it. And so that's kind of where some of the emphasis is on why. Now, would you go to the next slide, please?
Please.
I'm finding that the emphasis that's being placed on this over the past 6 years by the White House and OMB is really interesting. It's not necessarily the political people. Oftentimes it's the career people that are doing this, and they're getting a lot of support from the political people. But OMB has almost every year for the past 5 years, around budget time, issued guidance to agencies on, we'll give you more money if you can show and demonstrate the use of evidence, and we will also fund evaluation. So OMB wound up creating an office for evidence and evaluation that I was just flabbergasted that OMB would do something like that. They took somebody that was in charge of one of their primary divisions, a career person, and moved her over from, instead of managing $1 trillion worth of program, which she had, to running this office. And she's passionate and committed to doing this stuff. And so she's the one that sort of almost single-handedly got a lot of this stuff started. Launching a number of pilot programs for testing early intervention strategies to help disabled people at the Social Security Administration. They created a pool of discretionary funds for multiple agencies to serve disconnected youth. And so instead of children or disconnected youth that are from their communities, it's not just homeless, it's not social services, it's not just education, it's not just job training, it's money from different programs combined around a problem and a target audience. What they're doing is they're doing this now, and it starts this month in 10 communities around the country, and these programs are waiving their rules, and their Congress has given permission to waive some provisions in law to be able to combine some of this. The other thing they're doing is they're supporting outcome-focused reform. The budget this year triples funding for these kinds of programs relative to 2010 to $680 million. This includes, for example, the Department of Education's Investing in Innovation program, Labor's Workforce Innovation Fund, the Corporation for National Community Services Social Innovation Fund. So there's buckets of money that the administration has been putting aside to do this with the support of the Congress. They're also advancing something called Pay for Success. And this to me, it's a bit of a Rube Goldberg thing, but what they do is they say that here's an outcome we want to achieve. For example, reducing asthma cases going back into emergency rooms, but it's not giving money to health care, it's giving money to the housing people to clean carpets, because the trigger for asthma is dirty homes. But you can't pay for that with Medicaid money. But they're finding ways of being able to rechannel money so that they're no longer using Medicaid money for health care delivery, they're using it for prevention, and what they're doing is they're buying the result, which is a reduced number of kids going into emergency rooms, which also helps in the case of Baltimore, which has double the asthma rate for high schoolers. It is an education thing because it keeps kids in high school. If you miss more than 16 days, you'll likely drop out. This is something that is keeping the kids in high school. So this has multiple benefits. And the question is, well, there's no one owner agency that pays for this, and they're finding ways of getting around this. And the other is that the OMB is investing heavily into data collection to improve decision making, through education, through census, through workforce surveys in the Department of Labor. Now, the Domestic Policy Council in the White House has something called the Office of Social Innovation and Civic Participation. They have people there that are working on the political side as what are the benefits of doing these things in terms of building capacity and increasing the use of evidence and shifting resources to what works. and leveraging competitive grant programs, scoring criteria to do this. Next slide. So that's what's going on at the White House level. You go down to the agency level, and you'll find there's a range of agencies using a wide range of different tools. You have streamlined access to waivers from program rules so that you can be able to combine money. You have this notion of creating performance and incentive grants. You have at the focus on creating maturity levels in the use of program evaluation and evidence. And a non-profit advocacy group called Results for America has created a scorecard to measure the maturity of the use of program evaluation and evidence in different agencies. They've used it so far in education, labor, AID, and the Administration for Children and Families. I was down in CDC a few weeks ago and was talking about this scorecard, and they said, how do we volunteer to be scored? So some agencies are actually passionate about trying to do some of this. Now, some of the criteria is, do you have an evaluation office? Do you have access to data? Do you have a clearinghouse for some of your projects? The Corporation for National and Community Service, for example, has $80 million set aside in its Social Innovation Fund for the Pay for Success type grants. The Department of Education has a fund for competitive grants to replicate education programs that have high levels of effectiveness, and they wind up testing and promising new ideas. So these are some of the kinds of things that you're seeing in agencies. Department of Labor has a department-wide chief evaluation officer who sits in all the key staff meetings and talks about how something that it's a new idea, how it needs to have an evaluation component built in up front. You have the Department of Housing and Urban Development, where they've been given set-aside monies to be able to spend on this. Department of Education to get some set-aside funds for this. You also have the Department of Labor and Education and Justice creating clearinghouses for the evaluations they've done to share with other people so that other grantees can see what projects seem to work. So to go to the next slide, the thing that I also find fascinating is that Congress is actively involved. There are legislative set-asides that are being created in law. 1% in the Department of Labor is to go to the Chief Evaluation Office, 1% in the Social Services Block Grant. The Child Care and Development Block Grant we authorized last year has a 0.5% set aside for evaluation. You have the proposed increases for these Pay for Success type programs, creating a Social Impact Partnership Act that would create a fund in the U.S. Treasury to help support some of these things. And this is being sponsored by Todd Young in the House and Orrin Hatch in the Senate, both Republicans, both of whom are saying this is a good way of being able to engage the broader community. There's also a proposal to create a commission on evidence-based policy making to identify barriers to and the use of administrative data and making recommendations about data infrastructure and privacy, etc. So there's a lot of things, and that commission is the legislation is co-sponsored by Paul Ryan in the House and Patty Murray in the Senate. I mean, how different can you imagine? And a lot of this is being brought about by this advocacy group called Results for America, which has both Democrats and Republicans as champions on their board of directors. Next slide. State and local governments are into this as well. Washington State has an Institute for Public Policy, and they do cost-benefit analysis for all the pending legislation that's being proposed by their legislature. The Pew Charitable Trust thought this is a really cool idea. They are funding replication grants in 18 other states to have this done and have their state legislatures create something equivalent in their states. Pennsylvania and North Carolina, the governors of both are exploring the use of social impact bonds, which is something that was tried in the UK and is being attempted here. The Pay for Success or social impact bond grants are under development in 50 localities around the country. 7 of them, these grants are actively underway. They take several years for the payout. What's interesting is that Goldman Sachs is one of the funders for these things. It's backed up by the Bloomberg Philanthropies. The first one to report out as to whether they were successful and were going to get paid for achieving their end results was a program out of Rikers Island, a number of kids that were reduced recidivism going back into prison. Turns out that failed. Goldman Sachs lost its money. There's another one that was just reported out in Utah of having children prepared and ready to go to school at a younger age, and they're able to demonstrate more performance in school. That one succeeded. Goldman Sachs got its money. So these kinds of programs are popping up all over the place. The last slide. And the other thing that's happening is the advocacy groups and the foundation world are actively involved. Bloomberg Philanthropies currently has said that they're going to pour $42 million into helping 100 cities to become more evidence-based and use evidence in making their decisions. This is being run through Johns Hopkins University. You have the Pew Charitable Trust, as I was mentioning, is expanding the Washington State Public Policy Institute into other states. You have the Arnold Foundation, which is relatively new in the DC scene, out of Houston, Texas. They're supporting the notion of pay for success. They have invested $7.5 million into the Urban Institute to develop technical assistance and training for communities and nonprofits that want to attempt this. You have the Harvard Social Impact Bond Technical Assistance Lab that has been set up to provide assistance to those that are interested in trying to do this. So you have, in a lot of different sectors in society, people that are passionate about doing this. So they're taking a lot of the principles that started off in the quality world, and they're now moving it into a completely different environment, but with a lot of the support and stuff that has been around for almost 20 years, and now it seems to be taking off, but in a way that I thought was a little bit unexpected. So last slide. Sorry, this is the last slide. What can you do? First of all, is you might want to try to reach across disciplines. It may not just be people in the quality assurance shops and stuff. Look for ways to connect dots with others that are in other disciplines. Create advocates and engage people with different backgrounds and strengths. It could be risk management, it could be quality management, it could be performance management, it could be financial management, it could be budget shops. All of these people are engaged in trying to bring data to decisions. How do we pull this together? There's not an answer to that. You can help lead that. The second thing is, what I like to say, is become a data detective. Be curious about the data that you're working with in your organizations. The thing that we found in working with the Partnership for Public Service, where we've been looking at how agencies are using data, is that it's the analysts that interpret the data and provide unexpected answers to their bosses that they go, I didn't know that about our organization. And then they said, go find me some more of that. So if you can be data detectives and really spark the imaginations of your bosses or of your clients, they'll often come back and say, give me more of that. And then finally, make it easy for other people to read and use. I think that the notion of using logic models and process maps and statistical tools and GIS tools is something that comes natural to you. Help spread it around some of these other disciplines. And it creates ownership, and it creates confidence, and it helps them see a direct connection between analytics and your agency's mission. So in closing, for years you've been on the cutting edge of a new way of making government work more effectively, using quality tools. Take advantage of the energy and excitement that you're seeing today in this new effort, and expand your efforts to engage them and include them in more evidence-based, data-driven decisions being used to get results that Americans care about. Now, it's not one more slide, but it's actually the next slide. Here are just some resources that the IBM Center has pulled together. We have our website here, businessofgovernment.org. All of our stuff is free. You don't have to register. We've got about 350 different reports on a wide range of things, but we have a core of reports around use of analytics and data. And the last slide, honestly, it's really late. Here's a list of some of the reports that we've done. We've sponsored some, co-sponsored some with the Partnership for Public Service, and we've done some guides that may be helpful to you. We like to believe that this may be helpful to you and also to help maybe inspire some of your clients to take some of this on. Let me stop here. And melting. That would be really hard. But,
I hope that, by the way, that I don't think I need to. John and I were on Fed Talk Radio on Friday, and he was talking about much of what we're talking about today, but I just want you to underscore that John is considered a leading authority in this space on government performance. And his center.
Not at home, I can assure you, I'm not.
We're never at home considered much of anything. At least in my home, I know this. Poor John, I hear the stories. I'm below the dogs in my home. So.
I can testify to that, by the way.
Thank you. I just don't know what I'd do without his support. Thank you. But I underscore this because I just want to look at what I was most interested in learning when we were talking on Friday was how powerful this whole subject matter is across government. And when you listen to what Scott was talking about Baldrige, two things that come to mind when you think about Baldrige is the first criteria is leadership. How important that is. And when John was speaking about leadership, he was saying that it is already moved beyond the political to the career executives in many organizations. They see this as a sustaining basis for performance improvement. And so that leadership movement has actually migrated down from the political class to the career class. The second thing, when Scott was talking about leadership, he was talking about a sustained philosophy over time and how that translates into work culture. When John was talking about the performance matter, he was talking about working across silos. He was talking about working across political jurisdictions. This requires a larger collaborative network, and data makes those transactions possible. So I think I just wanted to underscore what you were talking about, how this moves us. When we in this room are talking about leadership, we are talking about process improvement. We're talking about results. Category 7 is results. And results in many cases for government are very complex indices of many very factors. I love the story about when you were talking about how they were talking about reducing asthma, and it was about cleaning carpets. When the Department of Transportation had a goal about reducing infant mortality, actually it was HHS. They went to the Department of Transportation and said, can we get car seats and cars? That was the way to reduce infant mortality. Across jurisdictions, the solutions made in any country are outside our competent area of jurisdiction. So this idea about opening up our eyes, thinking broadly. And I can't think of two more powerful speakers on that particular topic. We have about 10 minutes. And if I know that you can't be in the same place at the same time.
Close enough.
It's kind of like a black hole. It's kind of like a black hole in physics, you know. It's just, you can't do that stuff. But please just identify the question and to what speaker, and we can close with that. Does that work?
Yeah.
Any questions? You have to speak up to yourself.
A lot of the opportunities that are coming out mention CMMI ratings and ISO ratings. And a standard question that we've been asking lately, is there any objective evidence that those companies that possess an ISO or a CMMI rating are actually performing better than those companies that do not? And in the 3 times we've asked that question, the government has gone very silent. Do you know of any studies or any?
I'm unaware of any studies.
I'm not familiar with any data.
So there's an opportunity to create some data perhaps in the performance arena, because we keep getting this question, and the fact that we're asking what's the objective evidence that says one company is going to perform better because they have a rating or a certification, and we haven't gotten an answer yet.
Part of the public domain, and so that we can reach out and do analysis on the data that's being gathered by the agencies.
This administration has an open data policy, and they also saying that the data, it has to actually be machine readable, so it's not just posting PDFs up on the web. At the beginning of the administration, they created something called data.gov. Currently, they have about 275,000 data sets that agencies have posted. And they're saying that's just the beginning. There's also a law that was passed last year. It's called the Data Act, the Digital Accountability and Transparency Act, with the objective of trying to have federal spending data. So it's not obligation data, it's not like USA spending, but actual spending data available down to about $3,000 in granularity, reported quarterly. And it's not just spending through grants and contracts and stuff, but it's also interagency transfers between agencies. So this is going to require a huge amount of retooling of how agencies do things. But in talking with the people that are doing this, I said, showing numbers absent context is useless. And so what they're trying to do is, how do we actually tie this back to what is the money being used for? And so that gets some performance information, which is 275,000 data sets in many cases that are up there. So the question is, how do you begin tying some of this stuff together? I'm not sure that it's going to be something that's done inside the government. I think that a lot of it is going to have to be done through means that are a lot more innovative than what government might be able to do itself.
Something they can hit, but not something that's valuable to their goal, that is, are they cheating?
I can attest to two completely different data points on that. Social Security Administration a few years ago, the career staff that I talked to said that they were to develop their personal performance ratings at 85% of what the agency's targets were, or that the targets were, and so they were supposed to do it at 85%. So they made sure that if they were doing 100%, that they were clearly going to meet their targets. And I've seen in the Department of Labor, when I'm reviewing the annual reports, because I'm part of the Association of Government Accountants, review of agency performance statements, that consistently the Department of Labor in mine safety would have a target of here, and each year they would exceed that target. So obviously they weren't stretching. But if you look at last week, the Department of Veterans Affairs set a target of 90% veteran trust in VA by September 30th, 2017. That is a stretch goal. So you're going to find, it depends, and there they have Tom Allen, and there they have Secretary Bob, and they're going to do their darndest to make that happen. So if you have leadership that care passionately about a goal or something, you're going to see them trying. And other agencies, you may see, how can we ensure that there's compliance so we don't have anybody auditing us or giving us trouble?
John, if you recall, of course I'll be completely embarrassed if you correct me in front of everybody, but I give you permission. I recall, because I'm an old person, I bring the audio tape back. This tape is not digital. Back. I remember when we did a customer service under NPR, customer service, we had set up customer service standards. And one of the companies that we had benchmarked was AT&T Universal Card, USGA, and Federal Express. Federal Express at that time won the customer service with a benchmarking standard. And they won the national test in commercial activities for customer service. And I remember they had a very sophisticated capability around managing service delivery and customer responsiveness. I recall about a year later, Social Security actually beat them at customer service. So the reason why I bring that up is because the measures, going back to your question about do we fudge the data, certain things can be fudged, other things can't be fudged. But Social Security beat the best in the commercial world at customer service. And I remember exactly how they did it. That was part of that study. And when you get a bunch of people who have a goal and the permission to achieve it, remarkable things can happen. And so this idea about fudging, I think,
look at what PwC did.
There you go. So my memory is correct.
Yes, yeah.
Okay.
I thought you were standing up to give a question.
Oh, wow. I'm getting prepared for others asking questions.
By the way, Carolyn is